Hi, beautiful people. So I'm going to be talking about Bell Palsy, and then the reason why I'm doing this, I just want to create awareness so you understand when this kind of thing happens, what causes it. Recently, Angela wants people know she just had a baby, and of course she went through surgery, and she did a lot of she went through surgery, and she had a baby through surgery. And this is what happens when you have surgery. Of course, they give you a lot of medications, and sometimes it's kind of, it weakens your immunity, and it takes time again to build your immunity. Okay. And so she just noticed that she had a drooping mouth, and her eyes lid, she was being affected. First of all, she said her mouth was swollen and all that. She discovered that she had Bell Palsy. And at first, she didn't even know what it was till people started putting it in the comment that this is what she had. So I just want to create that awareness out there and to let you know that it's not because she just had a baby that's why she's experiencing that. Bell Palsy can happen to anybody at any age because it's caused by virus. Okay. Bell Palsy is a sudden weakness or paralysis of the muscle on one side of the face, either face, right? It results from inflammation or swelling of the facial nerve, cranial nerve 7. Okay, so we have cranial nerves up to cranial nerve 12. But this particular nerve that is affected by the facial nerve is called the cranial nerve 7, okay? Which controls the muscles of the facial expression, okay? So key features. So what you should look out for if you start experiencing this: sudden onset. So it just happens. You just notice that you're going to wake up one morning and then you just see that your face is swollen. So sudden onset, it will not tell you or give you signs, right? Sudden onset, often reaching maximum weakness within 48 hours. So within 2 days, your face will just be swollen. It happens suddenly, typically affects only one side of the face. So only one side of the face is affected. One side of the face. Symptoms. So what you should look out for when you experience this kind of thing may include inability to smile, because yes, you use your muscles, your face muscles to smile. So you might have inability to smile. You will not be able to smile. You might not be able to close your eyes, because the muscles also of the face controls how your eyelids closes and opens, right? Or you will not be able to raise your eyebrows. So you see right now I'm able to raise my eyebrow. You might not be able to do that, okay, on the affected side. Okay, drooping of the mouth. So the mouth is kind of drooping on one side. Loss of facial expression. So you cannot show if you are angry. You cannot show if you are smiling. You cannot show anything on your your face will just be like blank. And then decreased tearing. So you can start just be crying, right? Decreased tearing. So you might not be able to cry, or drooling. Decreased tearing or drooling. So some people they will be having like spit coming out from their face, and because they cannot control the muscles of their mouth as well, right? Altered taste sensation on the front of the tongue. So the front of the tongue, you might not be able to taste if your food is sweet, bitter, or that. So your altered taste, you might not be able to taste anything in the front of your tongue. And then increased sensitivity to sound. Funny enough, it's going to affect your ears as well, because that the ears is also part of your face. So you start having increase sensitivity to sound. So you'll be hearing everything will be echoing in your ears, and all every little sound it will become very louder in your ears. Okay, then what can cause it, right? what, because I want to know what causes it, right? What causes Bell palsy? The exact cause is often unknown because it just happens suddenly, right? You're not expecting it. You just wake up one morning, or just want, before you're suddenly in the evening, you notice that your face just starts swelling, right? But it is believed to be related to viral infection such as herpes simplex virus, mostly commonly implicated, varicella zoster virus, cytomegalovirus, Epstein-Barr virus. So you can see all of them has virus. It's actually a viral infection. Diagnosis. So diagnosis is how would they prove that it's Bell palsy that you really have, right? Primary clinical based on sudden onset of unilateral facial paralysis. Of course, your face is paralyzed on one side. Absence of other neurological defects. Okay, like it's only that your face. It's not like maybe something is wrong with your hand, because usually if it's stroke, usually it affects like once it can affect one side of your body, like from your face to your hand to your legs, but you just notice that it's only your face that is affected. So you know that that is Bell palsy. Okay. No alternative explanation, like you don't even know what happened. You just notice that your face is swelling, and all of a sudden your face is drooping, and your eyelids are not able to close, and you can hear like ring sound in your ears. So usually, okay, so it says no alternative explanation, like there's no stroke, no tumor, right? You don't have a tumor that could have caused the swelling. You just notice that your mouth is swollen all of a sudden. Sometimes people will be thinking that it's allergies, maybe it's something that they ate, because usually if you're allergic to like something like like seafood or shell or latex, usually sometimes people might experience swelling of their mouth, of their hands and all that, but that's not the case, right? So they can also use MRI imaging to check for it, maybe use if diagnosis is uncertain, or to exclude other causes. So they will do like the brain, they will check they will do scan of the brain, they will do scan of your face to check if like you have, maybe it was stroke, and if it's not stroke, then of course they will rule out stroke, and they will know that it's Bell palsy, right? Management. How do you manage it, right? How do you take care of it? Because it just happened all of a sudden, right? Some people, they get scared. Most times you have to go to the hospital, and then the doctor will prescribe steroids. They will prescribe steroids for you. This could be prednisone, are the mainstay to reduce nerve inflammation. Okay, because medication of prednisone is kind of like it deals with the nerves, right? Antivirus medication. So the thing was caused by virus, and guess what? You have to counter it with antivirus, right? And then, of course, they mention the names of the antivirals that you could take. I'm not going to mention them because I'm not a doctor. I'm not recommending it for you. Maybe consider, especially if it's a virus etiology, if it's caused by virus, or if it's suspected, right? Then supportive care. What else can be done? If you notice that the picture by my side, you can see that Angela also, she has this pink tape that she's kind of using to hold her face so that she can be able to, like, because her face is drooping to this side, so she has the tape is kind of very strong, and then it holds the face, stretches it to the other side. So you say you can put eye protection, because you know your eyes doesn't have ability to close, so you can put some eye pads or patches, artificial tears, drops, like eye drops. You can buy those from the pharmacy over the counter, to prevent the corneal dryness of your eyes, okay, or injury, right? Then facial physiotherapy, in some cases, if you can afford it, you can go to physiotherapy. They kind of massage the face, massage the mouth, and of course, as you see, they put a tape on it. Prognosis. So how long can this last? Most patients recover fully within 3 to 6 months. Oh my God. Some may experience residual weaknesses or psychinesis. That's involuntary movement during facial expression. I've actually seen this one. And I don't know, maybe I know something after birth really triggers it, because this lady, after she had her baby, like my distant cousin, we went to see her and we noticed that her face, she couldn't control the move. Her face was just, and she would just be blinking. She would just be like, her face would just be doing like this. Like she cannot control the movement of her face. So that's what they're talking about. Some may experience residual weakness, psychinosis, involuntary movement during facial expression. Like some people they cannot just really control how they move their face. Early treatment, they say improve outcomes. Okay. And then they said differential diagnosis. This plenty grammar. Okay. Stroke usually involves other neurological signs. Lyme disease, tumor affecting the facial nerves, Ramsay-Hunt syndrome, herpes zoster, which involves vesicles in the ears and more severe pain. All right, so it said if you notice that all these symptoms are going on and you suspect that it's Bell palsy, the best thing is to consult a healthcare professional as promptly for proper evaluation and treatment. Okay. So that's all you need to know about Bell palsy, and I hope you find this video very useful. And if it's useful, please like, share, and comment. And if you experience it yourself as well, you can also share your experience with us. And if you're a doctor or you happen to be a nurse, you can give us more insights. And I will see you guys in my next video. I hope you find this very useful. Love you guys. Bye bye. And don't forget to subscribe to my page. Thank you very much. Now bye bye.